Good morning, everyone. My name is Imara Kennedy, and I am the National Director for Communications and Community Engagement for AIDS Healthcare Foundation, or AHF. And we want to first thank you for joining us this morning for this very important media update on the impact of HIV and AIDS on women and girls across this country. As many may know, tomorrow, March 10th, is National Women and Girls HIV/AIDS Awareness Day. And it's a time that during this month of women's history, that those of us in the HIV/AIDS service organizations take a time to really elevate and create greater awareness around the impact of HIV and AIDS, specifically on women and girls. AIDS Healthcare Foundation is the world's largest nonprofit public health organization with a primary focus on addressing the HIV/AIDS crisis and epidemic across the globe. Is honored to have you join us today as we really share not only what have been some of the issues, the work that's being done, but really how our leaders, many who are women and who have joined us today, are in the trenches in cities all across this country, tackling the issue of HIV and AIDS, not only amongst women and girls, but amongst disproportionate communities that are disproportionately impacted by this epidemic. Just as a snapshot to give you a glimpse of who AHF is, if you're not already familiar with our organization, we are currently in 45 countries and domestically are in 17 states, including the District of Columbia and Puerto Rico. And we have over 1.7 million individuals in care. And as a part of our global family, we have 12 what are called affiliate organizations, which are legacy organizations that are a part of the AHF family, and that have been in for many, many years, some as close to 4 decades, have been in the trenches in local communities, particularly communities where HIV and AIDS continues to disproportionately impact those communities. So we are so pleased to have many of our affiliate heads today with us. If we could ask everyone just to be on mute, except for those speakers. And we will start with first introducing our Deputy Chief Medical Officer for the organization, Dr. Carl Milner. From there, Dr. Milner will turn it over to Ingrid Floyd, who represents 2 of our affiliate organizations. She is both the Executive Director for Iris House, based in Harlem, as well as the Interim Executive Director for World, based in Oakland. We will then close out the formal part of the presentation with Tracy Jones, who is the Executive Director for the AIDS Task Force of Greater Cleveland, and also serves as AHF's National Director of Grassroots Mobilization Initiatives. So with that, I will turn it over to Dr. Milner, and I will just say, as we close after Tracy, we will open it up for questions. For those in the media, if you want to pose your questions in the chat, we will be following those. As well, the recorded link will be sent to all immediately following the close of this session. So with that, Dr. Milner.
Morning, everyone. It is an honor for me to be here this morning to speak on a subject that is so important. Women have been impacted by HIV since the disease was first discovered back in 1981. Just for contextualization, everyone knows that HIV stands for human immunodeficiency virus, and it's a virus that harms the immune system, destroying a type of white blood cells that are important in fighting infection. This puts one at risk for infections, diseases, and cancers. As I stated earlier, HIV was first discovered in gay men in 1981 in major cities of San Francisco and Los Angeles, but what was not reported as the first case of HIV in a woman in the US was reported during that time as well. By 1982, there were multiple cases of HIV transmission in women to their children in major cities. One can have HIV without having AIDS, because the advances in medication have helped to stem the tide of HIV developing into AIDS. But how do women present with HIV? Women principally get HIV through either vaginal sex, sharing needles, or in terms of perinatal transmission, mother to child, during childbirth, labor, or by breastfeeding before the development of HIV medicines. The most common way, as I stated earlier, is that women get HIV is through sex with an infected male partner. That happens in about 70% of cases. There are some startling statistics. In the world, there are 37.7 million people living with HIV. Of those 37.7 million, 20.2 million are women. That's more than half. In the United States, there are 1.1 million people living with HIV, and 1 in 4, 25% are women. And this is particularly startling when we look at women of color. There are African-American women make up about 14% of the population. In 2015, they represented 61% of the new cases, 15% in Hispanic women. How do women present with HIV? They can present with no symptoms at all. They can present with flu-like symptoms, fevers, chills, body aches, and swollen glands. It could appear like the flu. In addition, women may present with mood, skin, and menstrual changes because of the hormonal imbalance caused by the virus. Often, women present to their primary care doctor with multiple yeast infections, and because doctors in the community don't think of women in HIV, it's often not picked up at that time. HIV presents challenges very different in women versus men. First, older women often present later with their disease because they don't think they're at risk, when in actuality, age-related changes in the vagina, less lubrication, and vaginal wall thinning increase the risk of transmission. As I stated earlier, 1 in 4 people in the United States who have HIV are women. And there are, because of this, that we have been able to determine there are many complications that occur in women that don't occur in men.
Hello.
As,
Yep. Okay. Thank you.
as stated earlier, women often have repeated vaginal yeast infections. They can suffer severe pelvic inflammatory disease. They have a higher risk of cervical cancer. There are menstrual cycle irregularities. There's a higher risk of osteoporosis, thinning of the bones. And in addition, there's a higher risk of heart disease, especially heart attacks. And often women with HIV may present with early menopause or more severe symptoms such as hot flashes. There also may be different effects on women by the HIV medicines, particularly in the beginning. Women suffered severe effects from these medications. Often we have to monitor drug interactions, particularly when we're looking at hormonal birth control. Women also, when untreated, have a higher risk of transmitting HIV to their baby during pregnancy or childbirth. Before you all state, is it all gloom and doom for women who have HIV? I will categorically state it's not. There is a solution. U equals U. If a woman is at risk for getting HIV, she needs to get tested and treated immediately by a qualified professional. Many of these aforementioned complications do not occur in women treated early and who come in for their regular pap smears, bone densities, and medical follow-ups. Again, remember at the start of this pandemic, HIV almost always led to AIDS and eventual death. But now there's a wonderful arsenal of HIV medicines, antiretrovirals that help prevent women from developing some of the side effects and live long, fruitful lives. Thanks. I'll pass it on.
Thank you, Dr. Milner. We'll now have Ingrid Floyd with Iris House and World.
Good morning, and thank you for that update, Dr. Milner. So I'll take it from the perspective of kind of what happens every day in a woman's life and how do we end up with rates of HIV infection amongst women particularly women of color, much higher than their male counterparts in some cases, but definitely much higher than our female counterparts for women of color. So one thing to think about is that the ways in which women make decisions is often different than how men make decisions. Women make decisions based off of feelings and emotions. Hence, oftentimes we see that women put love, they put the love for their partner, the love for their children, the love for their the people that they are caring for above their own needs. And when that happens, women oftentimes put their own health care later. So they get tested for HIV later than some other populations of people. So the likelihood of them becoming infected often happens for women of color in larger rates than we see in other populations. Another example, we know women are more likely to experience intimate partner violence. They're more likely to experience adverse childhood effects than their male counterparts, which also has a greater likelihood of HIV infection. Research has shown us that the more adverse childhood experiences someone has, such as homelessness, food insecurity, sexual abuse, any type of traumatic event as a child, increases why people later have an HIV diagnosis or a diagnosis of a sexually transmitted infection. And particularly, we see this in higher rates amongst women of color than we see in men. It's also to add the important impacts that the COVID pandemic has had, particularly on women. Women were the first to lose jobs during the pandemic because of the types of jobs and roles that they held. Often women had to stay off of work in order to take care of their children and because of childcare needs. What happened during the pandemic, we saw that rates of intimate partner violence increased, as well as a lessening of HIV testing. So in many of our clinics and our centers, we saw fewer people coming in and presenting to test for HIV and STI. We also saw that there was less access to healthcare services, particularly for women and particularly for low-income women, because many of them didn't have services, telephone services, data services, internet services to access telehealth. So again, creating and causing greater risk for women and hence higher rates, particularly for low-income women and women of color. We're also still challenged by the stigma in our society around HIV. Many people continue to live in shame if they have an HIV diagnosis. They're afraid to disclose their status, even to their own family members. They won't discuss their diagnosis with others. They don't talk about it publicly. And we find that often, particularly in communities of color, because of the stigma, people are afraid to come in and get tested. This is where agencies like Iris House, World, and some of the other affiliates of AHF come into play. We are the places where people come to address these issues, particularly women. Iris House was founded over 30 years ago to address the issues of women who are living with HIV at a time when most of the services focused on gay men who are living with the disease. So people come to our agencies in order to have a safe space to be able to talk about their diagnosis, to be able to get questions answered regarding new medications and new trends around HIV. When things like Dr. Milner mentioned, U equals U, undetectable equals untransmittable came out, people came to us because they wanted to know and understand, what does that mean? How do I become undetectable? How do I know what my viral suppression looks like currently? And how do I make sure that I move in the direction of viral suppression? It is agencies like Iris House and World and others like ACQC and Cleveland Task Force and Southside Health Center who are on the line today. It's agencies like us that connect people to quality medical services, like those services at AHF. We are the ones that help to address the social determinants of health for women. We know that the social determinants of health play a great role in why and how we prevent HIV in our populations and in our communities. If we are addressing things like housing, if we're addressing food insecurity, if we're addressing mental health and substance use, it allows us a greater advantage in being able to address and reduce and have an impact on the rates of HIV diagnosis, particularly in our communities of color. We assist women with identifying job training opportunities, with employment opportunities. We work with women who are living with HIV to offer them emotional wellness groups and support groups where they can come and talk to other women about their diagnosis, where they can talk to other women about disclosure. How do I disclose to my grandchild? How do I talk to my kids about my diagnosis? They come to our agencies so that they can talk about aging with HIV. One thing that Dr. Milner talked about was the changes in someone's body when they're on HIV medication. And we know that there's an impact and a difference when someone who's aging with HIV than someone who's in the general population and aging. A lot of our women are dealing with gynecological issues as well as oncology issues. And we want to be able to see and address those things. And oftentimes they come to our agencies because they feel safe talking to us about HIV along with their other healthcare needs. As well, we work with young women on how to prevent HIV. We want to empower young women to talk about and be advocates for their own healthcare, to be advocates for their own safety. So we teach and work with a lot of schools in trying to do this work and how do we educate people around HIV and STI prevention. And then lastly, I'll say there's a lot of new research that recently came out that showed that women who are living with HIV can breastfeed. So we also want to play a part in being a part of that research and getting women to consider clinical trials as they relate to HIV, but making sure also that they're up to date on the new research and the new findings and the new trends around HIV. And lastly, I'll say, we're on the ground daily, ensuring that women who are living with HIV and those who are at greatest risk for HIV get the equitable health care and services that they need to live a long life despite an HIV diagnosis. Thank you. Tracy?
Thank you so much, Ingrid.
Thank you. I'm sorry, Amara. Thank you to my colleagues for that wonderful presentation of where we are. I've been tasked today to talk about what do we do now? How do we go forward? And I want to spend a little time going backwards to go forwards. If we think about HIV in terms of how the discussion happened around the epidemic, that conversation mainly started in communities that were other than communities for women. It started with white gay men, and there was a progression to men of color. We saw that the conversation around HIV for women from our president, at that time it was President Reagan, didn't happen until well into the 80s. You've heard that most new cases were recognized in the early 80s, primarily from 1981 to 1983. But we saw in women, specifically women of color, there was this huge spike in 1993 of cases of women. And by that point, the horse was kind of out of the barn and we were playing catch up. And for a lot of the reasons that Ingrid outlined, it was really around communities that were experiencing the hardest challenges to begin with. If you talk about in Black community, when the world catches a cold, Black communities, specifically women, catch pneumonia. And that was present, omnipresent as it related to the work that we needed to do to get women up to speed about how to protect themselves. Flash forward to a lot of the discussion you've heard today, we are still experiencing a lot of those challenges. We had a bit of a heyday in the early 2000s as it related to women, that women were empowered to get involved with HIV. They were standing up for themselves. There were lots of advocates that were willing to put themselves on the front lines. And we've seen, much due to some of the epidemic of COVID and also just the world has changed, and where women we were lauding them, all of a sudden they became in a situation where they were pushed back into the back burner. So that's a lot of what we see now in terms of how do we address the needs of women. Ingrid spoke to those eloquently, but it also is incumbent upon us to tell their stories. It's something that I hear constantly over and over and over again. Isn't AIDS over? Why are we still talking about that? Aren't there pills for that? And even though that may be the case for some people, that may be the case for women in lots of instances, there's still challenges around whether or not, I can get the pills that I need, because I still got to take care of a family. So even if that care is something that's available to me, it may be so far out because, we see a lot of partner violence where even if the woman has acknowledged that she is HIV positive, when she breaks up with that man for reasons, if it is a heterosexual relationship, it may be others, sometimes they will flush her pills down the toilet. And when that happens in those instances, because the medication is so expensive, that woman may find herself in a situation where she can't refill that prescription right away. So now she's going without the medication that she needs. What do we do about that? We make sure that we support women. We make sure that we tell their stories. We make sure that we recognize that these are challenges that are real for women, and that we don't say, well, we've already got that knocked. We are so far away from that. Poverty is still a huge issue as it relates to women being able to take care of their families so that they can take care of themselves. Support groups play a huge role in making sure that women have someone to interact with, feel comfortable with, feel supported by. They want to see themselves. Sometimes we see commercials around HIV medications, they're primarily dedicated to men. So women don't often see themselves in that space to know that that is something that they should aspire to do. We've gotten to the point now that we see that there are preparations that men are currently using that we are now applying to women. There needs to be testing done so that we can ensure that women of childbearing years aren't putting themselves at risk for wanting to have a child, because often women will make a decision not to take the medications that they need because they're worried about being able to bear a child. So there are other things that we can do in terms of information that is dedicated to women, that shows women, that specifically talks to them in the language that they want to be spoken to in. And that includes, social media. Sometimes we forget that people are on social media regularly. When's the last time you saw an ad specifically addressing the issues for women around HIV and AIDS? Ain't gonna happen. We've got to really push manufacturers and people that are providing information to include women in that messaging. We know that housing is important, and women are communal. They need to have spaces where they feel comfortable living communally with other people living with HIV and AIDS without stigma. We need to make sure that women know that whatever medications that they're taking, they're going to be safe for them into the future, because sometimes women will make decisions based on the fact that this is going to impede something that I care about later. We want to make sure that when women make a decision to get into an intimate partner relationship, that they're not penalized in a way where they're ending up in jail because they're in a discordant couple. One's positive, one's negative, and somebody gets pissed off and then puts that woman in danger. So there are lots of things that we are continuing to look at as we further go into the twilight years, we hope, of this epidemic. But we are still in the crisis mode as it relates specifically to women of color and also to all women. Thank you.
Perfect. Thank you, Tracy. And I want to thank all of our speakers this morning. And I know that we have a couple of questions in the chat, but I also wanted just to say, particularly for our media outlets, what you have seen is a representation of the myriad of thought leaders, both in the medical side and the public health side, and the deep community engagement connection side of this work. I want to just recognize, and so that you know, as I shared before, that we are in 17 states, including the District of Columbia and Puerto Rico domestically, and that across the country, many of the heads of our affiliate organizations are women and are women of color. And so they can directly speak in terms of life experiences of living and breathing in this work each and every day. I want to just recognize Rosemary Lopez, who is the executive director for the AIDS Center of Queens County, that's obviously based in Queens, New York. Nicole Roebuck, who is also with us from AIDS Atlanta, based in Atlanta, Georgia. Vanessa Smith, who is with the Southside Health Center, based in the South Side of Chicago. And again, these ladies represent just a sampling of the myriad of leaders that we have across the country and across the globe that are doing this work, and that are a resource to you all in the media on any myriad of subjects, not just solely around HIV and AIDS. With that, I want to pose the question from Jasmine Tiffany, which says, for women of color with HIV and limited health resources, where does she begin to look for the support she needs? And I'm going to actually ask Rosemary if you can speak to this, addressing, holistically around women of color, but if you could also specifically speak to the needs around Hispanic and Latina women.
Okay, so I am in Queens. I'm Rosemary Lopez. I'm the executive director of the AIDS Center of Queens County, and we've been an affiliate of the AIDS Healthcare Foundation for over 7 years now. We're throughout Queens. We're in Manhattan. We're in the city, and all the boroughs at this point with AHF support. But we've been servicing women for 38 years. Okay, we've been servicing women either through prevention and testing, either through housing. 50% of the women that we service in housing are women and children. So they're homeless and they come into our organization and we find them permanent housing, as well as mental health. We have a syringe exchange program, a mental health program, and a harm reduction program. And 40% of them are women that come in for services, either support group or individual work. We run a very large nutrition program here at ACQC with the AIDS Healthcare Foundation's support. We do a community pantry and a food and nutrition pantry. We have been servicing, I would say, out of the 12,000 clients we service a year, 5,000 of them are women. People coming in that are homeless, that go through transitional housing. We house them in transitional housing and then find them permanent placement. This has been an ongoing service of ACQC, legal services we have here. We do a whole support, wraparound supports with AHF here for our pharmacy and for our medical. We're also big proponents of advocacy. We're involved in advocacy efforts with AHF throughout, fighting for whether it's 340B or Article 28, fighting for services that the community needs. When COVID hit, we were the only organization open here in Queens. The roads were, everything was desolate, and we were actually feeding people on the street. That's what ACQC does, we continue to do, and we are available for any supports that are needed for women in the community. If they don't have medical services, we can get them medical services. But thank you for asking me, Amara.
Thank you, Rosemary. Ingrid, do you want to chime in here? Because that's a lot of the work that, as you shared, Iris House and World are also doing in 2 different sectors of the country.
Yeah, so thank you for that question. I think one of the places and one of the things that women who have limited resources can do is to go online and to search for your local AIDS service organizations. So AHF has a website, Amara can put it in the chat box, that allows women to go to that website and identify based on their zip code, what are some of the local resources. You can also, so the best place for someone to start is with a local AIDS service organization, because that organization can help to identify and assess what are their needs, whether those needs be around getting medical care, because sometimes people just need connection to a medical provider. Sometimes women need housing resources. Sometimes we know women need emotional wellness groups. So the best place to go, and I think the best thing for women to do who have limited resources is start by a simple Google search to find out where is your local AIDS service organization, or to use the AHF website that will direct you to one of our organizations. We can then help to do an initial assessment. And what our case managers are trained to do is just that, connect them to the resources in the community, in their specific community that they need. So thank you for that question.
Thank you, Ingrid. I'd like to just take a moment to open it up to any of our other media outlets that are in, if there's anyone else that has a question. And if so, you can just take yourself off mute, identify yourself and who you're with. That'd be very helpful. Thank you. Well, that's a wonderful thing. When the media doesn't have any questions, that means our team has shared lots of resources. So again, we will follow up with this link for those who need it with any specific things that were shared. As well, I've put in the text myself and my colleague Lauren Hogan, who's also on, as well as Jackie Schishner, who is our VP of Media Relations, who's also on. We represent the communications team for AHF, and that is for any community across the country, even for those that we do not have a physical presence, and for our affiliate organizations. You can find out more at ahf.org, which I'm putting in the chat, or as Ingrid alluded to, there is a website that is a direct link that anywhere in the country that anyone is located, that they can chime in their, their zip code, and it will direct them directly to resources to where they are at in the local community. And that is freehivtest.net, but I'm going to put that in the chat so that we will have that as well. Great. So with that, again, I want to thank our media partners for joining us today. I want to thank my colleagues for helping to put this together. And of course, our great thought leaders, Dr. Milner, Ingrid, Tracy, and our affiliate heads for joining us this morning. And again, for those in the media outlet, please feel free to reach out to us. As has been shared, we're not only one of the leading organizations globally around HIV and AIDS, but through all of our affiliates and through AIDS Healthcare Foundation, we are very much in the forefront of addressing the affordable housing issue that we know is another epidemic taking place around the country, as well as food insecurity. And as Rosemary and others shared, we are also a very strong advocacy organization that speak up around the myriad of social justice and civil rights and human rights issues that we know are direct determinants to why individuals may be infected with HIV or be newly diagnosed with HIV and AIDS. Thank you again for joining us. Have a wonderful day. And remember, tomorrow, March 10th, is National Women and Girls HIV AIDS Awareness Day, and we look forward to following up with all of our outlets. Have a wonderful day, everyone, and continue to be safe.